Let's talk about ophthalmic findings in respiratory disease. We'll talk about the findings in COPD, tuberculosis, sarcoidosis, cancer, and in cystic fibrosis. Starting from COPD, COPD causes a type 2 respiratory failure, leading to carbon dioxide retention, which causes papilloedema. Tuberculosis classically causes findings such as choroidal granuloma, choroiditis, and uveitis. You can also find retinal arteritis. And patients receiving treatment for tuberculosis, such as ethambutol, can lead to optic neuropathy. Then sarcoidosis has similar feature such as tuberculosis, including choroidal granuloma, same choroiditis, and uveitis. Those are the similar features: granuloma, choroiditis, uveitis. What's special? Sarcoidosis causes infiltration of the lacrimal gland that causes dry eye. This is known as a Sikka syndrome, dry eye syndrome. Can lead to bilateral facial nerve palsy that causes an exposure keratopathy. Sarcoid granulomas can infiltrate the meninges and causes a meningitis, and this can lead to raised ICP, and this will lead to optic neuritis and optic neuropathy. Carcinoma can cause Horner syndrome, especially if the cancer is in the apical region, the Pankos tumor, that will cause a Horner syndrome, classically ptosis, meiosis, and hydrosis and anophthalmos. And that ptosis is usually partial. Then it can cause the carcinoma-associated retinopathy. Cystic fibrosis, long-term cystic fibrosis causes a pancreatitis, which leads to diabetes and which leads to diabetic retinopathy. The features of diabetic retinopathy are macroaneurysm, dot and blot hemorrhage, then hard exudates, and then ultimately neovascularization. So those are the features of eye or ophthalmic features in respiratory disease.